Hello, everyone. My name is Jacob Kim, and I'm currently a third-year student in the University of Pennsylvania, alongside my mentors Reem Azar and Dr. Michelle J. Johnson, and my mentee Phillip Kim. Today, I would like to present you the usability of a self-stretching wrist and finger device for chronic stroke patients with spasticity. As a quick background overview, stroke is a condition in which there is damage to the brain after blood supply has been restricted or blocked, either in the forms of an ischemic or hemorrhagic stroke. Some symptoms include hemiplegia, hypertonicity, and spasticity, which are all forms of muscle stiffness, with spasticity specifically focusing on velocity-dependent stiffness. Some treatment options include long-term physical therapy, and we find that nearly a quarter of people within the United States suffer from stroke, and yet almost a third of post-stroke patients receive no physical therapy. Therefore, the objectives of my study is to develop a rehabilitation device that meets these following criteria. It needs to be affordable, allows for a passive self-stretching rehabilitation session, stretches both the wrists and the fingers, and usable for varying ranges of spasticity. The device design relied on two fundamental mechanisms: a rotating dial for the wrist extension and flexion, and an inflatable grip for the opening and closing of the fingers. The primary purpose of our study was to develop both early stage and late stage prototypes and ask survey questions to ensure that overall device comfort and usability would improve. We asked 10 healthy controls on the usability scores for both early and late stage with two different groups. The question asks were on a 1 to 10 scale for comfort, pain, muscle tension, and device security. Comfort was favorable at higher scores. Pain was favorable at lower scores. Muscle tension was favorable at lower scores since the muscle tension was an indication of unnecessary upper arm tension. And device security was favorable at higher scores because it was an indication of how properly the device secured the arm. As you can see over here, this is a picture of our early stage prototype, and this is a picture of our late stage prototype. Now, for the collected data, we see that the early stage prototype had a low comfort value, meaning that the device was overall not comfortable. And although it did not cause pain, as you can see over here, it did cause a lot of unnecessary muscle tension and then was not able to secure the device properly. Therefore, we made these three adjustments. First of all, to account for smaller wrist sizes and varying wrist sizes in general, we were able to make optional and detachable wrist padding. And to make sure that patients without much balance or arm control can rest on their device nicely, we decided to add this adjustable and extended elbow padding over here. And for patients struggling with device security in general, either due to a high spastic motion or because of low cognitive function or motor control, we decided to add these arm straps so that patients could strap their arms nicely and tug so that they would not rattle or be unsecured. We can see that after making these changes, we were able to have a much larger comfort score. And although pain was also at a minimal, we see that there was very low unnecessary muscle tension and very high device security score, meaning that the device was able to secure the arm properly and nicely. For our future directions, we plan on testing the usability and clinical effectiveness of the more permanent final prototype, as you can see over here, with both healthy controls and with post-stroke patients. Thank you so much for watching.